What are the actual causes of death in the US and the Western nations? What is it that actually kills us? If you were to ask most anyone that question, including health professionals, chances are that the answer you will receive is that heart disease, cancer, and diabetes are our top 3 killers. But are they really? Has that come to be the expected answer, or is it really the most accurate answer? In this episode, I challenge you to delve a little deeper into understanding better the actual causes of death in the Western nations. Heart disease, cancer, and diabetes may well be listed in any database as the top 3 killer diseases, but as one begins to study research closely, it becomes evident that these 3 conditions are not what we can call the primary or first causes of death in the vast majority of cases. Rather, these conditions are what may be better called the secondary causes of death. What does this really mean? In simple language, it means that let's say if a person dies from a heart attack and consequently we conclude that the cause of death was heart disease, we are engaging in what might be called circular reasoning. Why? Because the real question we should be asking is, what was the primary cause or causes of heart disease in the individual who died? What causes heart disease in the first place? And we should be asking the same question for cancer, for diabetes, and other chronic diseases. Why do so? Here is the answer to that question. There is mounting evidence to indicate that the vast majority of what are actually the causes of death, what I'm calling the first or primary causes, are in fact factors that are oftentimes well within our control in the vast majority of cases. In 1993, the Journal of the American Medical Association published a paper which showed that of the 2 million deaths approximately that occurred that year, almost half could be attributed to only 3 causes, and these were smoking, a poor diet, and lack of physical activity. Since that time, there have been numerous scientific publications that have ratified the link between diet and health. In 2008, Harvard researchers published a paper in the British Medical Journal entitled Combined Impact of Lifestyle Factors on Mortality, a Prospective Cohort Study in U.S. Women. In this study, researchers followed 80,000 women between the ages of 34 and 59 for a span of more than 24 years, during which about 9,000 women died. Researchers found that there were 5 contributing factors that were responsible for premature death and disease in these women. And these factors were smoking, drinking alcohol outside of recommended guidelines, overweight or obesity, a poor diet, and lack of physical activity. In fact, researchers in this study concluded that these 5 factors alone increased the rate of risk of death from cancer by 3 times and the risk of death by heart disease by nearly 8 times. The results of the study can be put another way. If these 5 factors are taken care of, in other words, the combination of not smoking, drinking within recommended guidelines, being physically active, eating sensibly and well, and maintaining a close to optimal weight, these 5 factors can help you decrease your risk of death from heart disease by nearly 90%. The risk of death from cancer can be reduced by 66% or 2/3, and the risk of death from any cause by 75%. These numbers suggest that while we may not have absolute control over our destinies vis-à-vis our health, we are decidedly far from helpless. Today, any way you look at it, whether it is Europe, the United States, Australia, the Western world in general, we are mired in an epidemic of overweight, obesity, and chronic diseases. What is our way out of this quagmire? Well, perhaps one way to start is by clearly distinguishing primary from secondary causes of diseases. Is doing so really that important? Yes, I believe it is, because understanding and establishing the primary causes of diseases helps us understand exactly how much influence we really have over preventing these diseases. In the vast majority of cases, heart disease, cancer, and diabetes don't just happen to the most of us. In fact, we can exert a great deal of influence over both preventing these diseases and over the quality and duration of our lives. Isn't it time we did so?